said, I'll be talking about living with dementia and dementia caregiving during COVID-19. And this is an update. Some of what I will be talking about will be repeated from my talk about 6 weeks ago, just because that's what we do with the important stuff. But most of what I say today, I didn't talk about 6 weeks ago. If you are interested in seeing that talk, you can go back and watch it. It's available on YouTube or on our Memory and Brain Wellness site, as well as several other excellent presentations by my colleagues. So check those out. So my goal here today is that you will leave with some clear, up-to-date information about your risk for COVID-19, some strategies to manage that risk, and also some resources so that you can stay up to date about this information. It's all a moving target at this point. All right, so the virus that we're all talking about, the one the kids are calling the Rona, is a novel coronavirus called SARS-CoV-2. SARS-CoV-2 causes the illness COVID-19, which is short for Coronavirus Disease 2019. We know that COVID-19 can be very serious, and it can range all the way to being asymptomatic. Since we don't have population-wide testing right now, a big question is how many people may have been infected and never experienced any symptoms. We also know that older adults are at greater risk for serious disease, and we're finding that residents of nursing homes, long-term care facilities, assisted living, and adult family homes are also at greater risk. There are several health conditions that we know are connected to a greater risk of complications or worse infections of COVID-19. The first bit of good news is that dementia is not on this list. Higher risks include chronic lung disease, serious heart disease, chronic kidney disease, to the extent that someone needs dialysis, liver disease, immunocompromised, obesity, and diabetes. All right, well, much of what I'm about to say next is not good news. And that is in the United States, kind of a status update. We have about 1/3 of the world's confirmed cases, whereas we only have about 1/20th of the world's population. Last week, the US was adding confirmed cases at a faster clip than other places. This week, though, things have stabilized a bit, and hotspots are several countries in South America, Africa, the Middle East, and then also Russia. A few countries, Iceland, New Zealand, Taiwan, and Japan have fared better. And the things these countries have in common is that they acted quickly to contain their outbreaks, whereas there is a delay for us in the United States. However, more good news, and that is that in Washington State, our rates of infection are decreasing. Hooray. So this is information that I pulled this morning at 8 a.m. from the Washington State Department of Health website. I want to point out, though, that it is information, the data is from May 11th. So there's a little bit of delay in getting the most up-to-date data, but here it is. This is the latest that I could get. And what this tells us is that more women than men are being diagnosed with COVID-19. And it's unclear what to make of that, if it's because more women are seeking care and then their information's entered into the database, or if that's a true finding. What we're also seeing is that more people in middle age are being diagnosed with COVID-19. And I want to point out here from this graph that people who are 60 years old to 79 years old, about 22% of the cases fall into this age group in Washington State. And only 9% of the cases in Washington State are for people that are over 80 years old. I want to warn you, this next part gets a little bit grim. and that is the statistics about deaths. So though more women are contracting COVID-19, or at least being diagnosed with it, more men are dying of COVID-19, 54% compared to 45%. And this is something that's been seen around the world, and we're not sure what to make of it. And then also, this part is really concerning, and that is that though only 9% of people 80 years and older are 9% of the cases are in people 80 years and older, 52% of the deaths are in people who are 80 years and older. And if you combine the 60 to 79-year-old age group with the 80 plus age group, you'll see that in Washington State, 9 out of 10 deaths have been in this age group. And that is higher than what we've seen in the nation. In the nation, it's been more like 8 out of 10 deaths. I should say that this may not be the actual numbers, since not everyone is getting tested. It could be that there are people dying from COVID-19 that aren't being counted, and it could be that there are people surviving COVID-19 who aren't being counted. So that's the data we have so far. All right, so more grim data, and that is that 1/3 of the deaths nationwide have been linked to outbreaks at long-term care facilities. And so thankfully, the Department of Health has stepped in and laid out some guidance for long-term care facilities to namely identify infections early, screening all residents and staff at least once a day, and immediately isolating anyone with symptoms, staff or residents, and warning long-term care facilities and staff that residents with COVID-19 may not show the typical symptoms. And so another important thing that the Department of Health is saying is that they want to be notified if there's anyone in the facility, staff or residents, who have known COVID-19, or if there are clusters of people with a respiratory infection. So what we can do is advocate for our loved ones who have dementia, who live in long-term care facilities, that the facilities follow this guidance and get help from the Department of Health when they need it. And then also, other things that we can do, that is keeping up with current recommendations. And that's something that is really challenging right now. It could be a full-time job. But I want to say that there has been no change to recommendations to wash hands. Wash your hands when you get home, wash your hands before eating, wash your hands before touching your face, nose, eyes, mouth. Try to avoid those things. I do them all the time. It's really hard, but it is good to have really clean hands as much as possible. Staying home as much as possible is also important. And then this last piece too, which is physical distancing. That there's been no change to the recommendations regarding that as well. So there are some rare cases of kids getting serious complications from COVID-19, but most kids don't get serious disease. However, we do know now that kids can spread the virus. So those of you who have grandkids and you're keeping up with those virtual connections, that is really recommended at this point. You could think about having porch visits or visits through car windows up, if the kids are older and they can understand the importance of physical distancing. Some newer recommendations. This is a recommendation that came out just a couple of hours after my last talk, about 6 weeks ago, and that is that the CDC now recommends that most people wear face masks when they leave the house. And so I will say that it is also very clear that if people can't remove their own face mask, they shouldn't wear one. And I think too that I find face masks to be uncomfortable. Sometimes I work in an exam room even though I'm not in with a patient, just so I don't have to put on that face mask again. But it is, I think, thinking about the priorities here, the first priority is really this physical distancing. The second priority is having really clean hands. And then the third priority is using a face mask. So if somebody's really not gonna, if it's not gonna be possible to wear the face mask, think about how you can step up those other two priorities to keep people safe. All right, so there's been some buzz about different medications. There's been some wondering if certain medications increase the risk for complications of COVID-19. On more close scrutiny, this has not borne out, so please don't stop taking medications unless your healthcare provider has recommended it. One thing that is very clear from the evidence is that smoking does increase the risk of complications of COVID-19, and so now is a really great time to quit smoking. Staying away from sick people is still good advice, though we are starting to think about how long it's safe to delay care, especially for care that needs to happen face-to-face. And so one of the guidelines is that we're starting to schedule surgeries if there's some concern that harm could happen if the surgery doesn't happen in the next 3 months. All right, so SARS-CoV-2 is transmitted mainly person to person. That's why that physical distancing is so important. But it can also live on surfaces for a while, different surfaces for different periods of time. And so I wanted to talk a little bit more about cleaning and disinfecting. So cleaning means that there's really no dirt, no spills or crumbs or gunk on the surface. And that's what we have to do first, is to get all that stuff off. And then second, we have to use a disinfectant to really kill the virus that could be on the surface. It's important to wear gloves because disinfectants are very harsh. And it's also important to read the instructions because different disinfectants need a different amount of time in order to be on the surface to kill the virus. And so what that time means is that that surface should be wet with the disinfectant for the full amount of time. So if I spray a disinfectant and I wipe off my counter and it dries within 30 seconds, if that disinfectant needs 2 minutes, then that means I need to wipe that counter for longer so that it'll be in contact and really kill the virus that's there. All right, so all of the available disinfectants out there have not been tested yet against SARS-CoV-2, but we think that those that kill other human coronaviruses likely kill SARS-CoV-2 as well, because it's actually not a very robust virus, thankfully. The EPA has a website that has a list of disinfectants that we think can kill SARS-CoV-2. It's 17 pages long, so feel free to check it out. And I'm sure that you all know this already, but somehow it seems necessary to say it anyway, and that is that disinfectants are for surfaces only. They don't go on or in people. All right, so we know that people can spread COVID-19 to pets. This is not happening very often, but there have been some cases that it has happened. There have been no cases yet and no evidence yet that pets are spreading COVID-19 to people. So you are safe from your pets as far as we know, but your pets may not be safe from you if you have COVID-19. All right, so this is something we talked about at the last talk, but I think bears repeating, and that is when to call 911. So if you or your loved one has trouble breathing, chest pain, if lips or face turn bluish, if speech is slurred, and if you as the care partner feel confused yourself, please call 911. Even though there's a global pandemic right now, that doesn't mean that other health problems can't crop up. So please, please, please don't avoid getting urgent assessment and treatment in an emergency room for signs of a heart attack or stroke. Hospitals are working really hard to keep patients safe. We're all wearing masks. We're asking all visitors and all patients to wear masks. So please don't delay treatment for these important, timely conditions. All right, so we've all heard about possible COVID-19 symptoms. The ones that seem to be getting the most attention are cough, shortness of breath, and fever. The other ones can also happen: chills, muscle pain, headache, sore throat, or a new loss of taste or smell. Another one that seems to be emerging as a possible symptom is severe or persistent lightheadedness. More rarely associated, but have also been reported, is blood in the saliva, runny nose, vomiting, and diarrhea. There's a few other symptoms that are not rare, often linked to COVID-19, but also can be related to so many other different causes. And those are fatigue, reduced appetite, increased saliva production. Now again, all of these symptoms could be due to other things, not just COVID-19, and since also not all people who have COVID-19 need to be hospitalized, it's really important to talk with your primary care provider about what's going on so he or she can help you with the next steps. Also, you'll notice on this list there isn't anything about delirium or a sudden change in alertness, memory, or thinking, or a sudden change in mental status. But if your loved one with dementia has a sudden change in alertness, memory, or thinking, I recommend asking your primary care provider to get your loved one with dementia tested. Though the Department of Health doesn't have that listed as a possible COVID-19 symptom, it's a known symptom of an infection in people with dementia, and the Department of Health allows for clinical judgment in deciding who gets tested. So please do advocate for that with your primary care provider if your loved one with dementia has a sudden change in mental status. All right, so the type of testing that happens, it's called PCR testing. And these are, you've maybe heard about a really long swab that goes really far back and it's very uncomfortable. And it's a nasopharyngeal swab. And what it's testing for is genetic components of the virus. They are testing a different kind of test where people can just self-swab just their nostrils, the nasal passages. But we don't know yet how good that test is compared to the nasopharyngeal swab, and so that's under research. All right, so testing at UW Medicine is pretty quick. We have a turnaround of less than 24 hours. There's some variation around the Seattle area. Some can take up to a week, so please do talk with your primary care provider about what you should expect. There are lots of drive-through sites, which are great. What we know is that our labs have the capacity to test more people, but it's the materials that are limited. And so currently people still need to meet criteria, meaning that testing is not yet done for asymptomatic people unless there's been a close exposure. So that's someone that you know coughed on you or sneezed on you who had COVID-19, or somebody in your household had COVID-19. I want to say too that PCR testing is a really good test. It's a pretty accurate test at telling us who has COVID-19 and who doesn't, but there's no such thing as a perfect test. And so if there's a high suspicion, and especially if some new symptoms have emerged, people can be retested. So don't hesitate to ask for that from your healthcare provider. Right. So another thing that's being talked about right now is antibody testing, also known as serologic testing. And this one is a blood test. Antibodies are what our bodies make to protect us from getting sick again from the same germ. And so positive antibody testing means that I've been exposed in the past to the virus. But what we don't know is how much time it takes for people who have COVID-19 to develop antibodies. So it's not a good test for an active infection. There's a lot of unanswered questions right now about antibody testing for COVID-19 or for SARS-CoV-2. It's not clear if having antibodies to SARS-CoV-2 means that I would be protected from getting sick again. We don't know if it means that I'd be protected from getting as sick as I did before. And we don't know if I have antibodies, if that means that I couldn't pass on a virus to somebody else. So this next question about what is herd immunity, that really only has meaning if we are able to make antibodies that then protect us in the future from getting COVID-19. But what herd immunity is when most people in a community have immunity or protection from a disease, and people become immune by getting vaccinated or by having had the disease and then developing effective antibodies that are protective. For some diseases, more than 9 out of 10 people have to have immunity to keep the disease from spreading. And so this next question, how close are we to it? I haven't been able to find anything more up to date, but about 2 weeks ago, I was a part of a education seminar with Dr. Helen Chu from the Seattle Flu Study, and then also Dr. Keith Jerome from the UW Laboratory Medicine, and they said that their early research had indicated about 2% of the population had been exposed to SARS-CoV-2 so far. So that means we're a long way from herd immunity. All right, I just want to briefly touch on again this issue of communication, how to talk about the virus with our loved ones with dementia. I think mentioning right off the bat, this is not easy. This is a difficult subject, and I want to just briefly mention again some of the principles I talked about the last time, and those are, when I talk about things, I want to make sure that I'm doing so in a way that provides reassurance and calm, and then also that I'm providing the amount of information that is needed at the time. And so I really like the following few statements, things like, we're doing everything we can to keep our family healthy, or it's going to be okay, we're doing our part to help, or things like, I miss that too, we'll go together as soon as it's safe, or this is how we stay safe right now. I like all of these too because they're honest, but also framing it in a positive way that can be reassuring. And then it's important to, of course, find another engaging activity instead of the risky one that our loved one with dementia may be wanting to do. And then also, I think I'm probably a little bit of a squeaky wheel here, but being aware of emotional contagion. If I'm feeling calm, my loved one with dementia is more likely to feel more calm. All right, so like I said, I've only just touched on some of the communication strategies, but there's a lot going on online right now, virtual education, most of it free. You can check out videos from Teepa Snow. She's really a leader in this field, has some great videos about communication. The Alzheimer's Association has some webinars coming up that sound really great, and the Alzheimer's Foundation of America and other memory clinics around the country as well. So check it out. All right. So our governor started us off with this stay home, stay healthy, basically kind of sheltering in place strategy for flattening the curve. And this has shifted ever so slightly into what he's calling safe start, and we're in phase 1 right now. I don't know about you, but I've looked ahead to see what phase 2 includes. The timing of when that will start is not known at this point, but it includes opening of barbershops and beauty salons. We get to do outdoor activities with people not in our household, and restaurants can open at 50% capacity. Excuse me, you can check out more details on the governor's website. But I just want to introduce this idea of what might be allowed versus what might be advisable, depending on each of us, our own individual risk. Another thing to really be thinking about is the cost versus the benefit. So if my quality of life will be exponentially increased by being able to take advantage of some of these things that will be allowed during phase 2, then it may be worth it when compared to the risks that I'll be taking. I think all of us, we get to make this choice for ourselves, based it again on what gives us quality of life and also what we know about our own risk of contracting COVID-19 and what that might mean. All right. Talked about some difficult things today and giving you some bad news, but I want to end on a positive note, because there are some really positive things to talk about as well. And one is that our sacrifices to stay healthy really do matter. I'm feeling a little choked up even just talking about this, but as a healthcare provider in Washington State, it's really been amazing to be a part of this state and all of you that have made sacrifices to keep our hospitals from really being overwhelmed with COVID-19 patients. I think we've all heard about what's happened, in other parts of the world and other parts of this country where healthcare providers are just overwhelmed and are sacrificing their own health and lives to keep people to treat people with COVID-19, and that just hasn't happened here. And so thank you for your sacrifices. They really matter to us as healthcare providers. Other consolations is what we talked about, is just that we have choices. We may not like our choices. They may not be the first thing that we would choose, but we do get to make some choices coming up, especially as we move into different phases of this epidemic. I think about consolations too, in that we are all grieving, and I think it helps us to acknowledge our grief. It helps us to console each other and console ourselves. And when I'm talking about grieving, I'm talking about things like grief about people dying, grief about people being out of work and hungry, grief about canceling travel plans or not being able to hug our loved ones that we don't live with. And even grief about things like not being able to get a haircut or changes to our routine or not being able to find yeast or flour at the grocery store. All of these things are good to acknowledge, and I think it's a good chance for us to practice our mindfulness skills, so gentleness, finding grace for ourselves and for each other, and having that attitude of curiosity and openness and acceptance. And I don't know about you, but it's a big consolation for me that the sun is shining more. I've noticed the days are longer and flowers are blooming and plants are greener. And getting outside even for a short period of time, I think, is really good for us, and it's much easier to do that right now. All right, so some good resources. Again, the Department of Health has a wealth of resources about COVID-19 that are trustworthy, as well as the CDC. And this website for the EPA is where you can find information about different disinfectants that can hopefully, most likely, kill SARS-CoV-2. This website with apple.com/COVID-19, this is a collaboration between the company Apple as well as the CDC, and it's a symptom tracker. And so if you're starting to have some symptoms and want to know more, it's a great website to check out. This website, germdefense.org, is also one that I really liked. It's defense with a C because it is an organization in Great Britain. But it's a website that gives a lot of information about disinfecting your home, how to reduce the amount of virus that might be around in your home. And then also the Alzheimer's Association at alz.org. They also have a 1-800 number. They have great dementia-specific information, and again, these workshops that are coming up to check out. I want to say that if you're experiencing anxiety that's harming your health, please do reach out for help. King County has a 24-hour crisis line at 1-866-4-CRISIS. And then last but not least, our website has many more community events and programs that are coming up. I know that I'm looking forward to the next talk from Dr. Rhodes on self-compassion. And again, there are many talks that have already happened, excellent ones that are accessible from Drs. Burnside and Hansen, Dr. Rhodes, Dr. Parsi, and Mary Grace Becker. So check it out. All right, and I'm ready to take some questions if anyone has